I'd like to thank you for joining us for this 2021 legislative session overview and grassroots skills workshop. My name is Carissa Miller. I'm the Program and Communication Specialist for Montgomery County Medical Society. I do have a few housekeeping items before we begin. We have muted participants at the beginning of this call for sound quality purposes. So if you do need to unmute yourself on a phone, you can press *6 and then press *6 again to remute yourself. And then on PC or on Mac, you should see a button that looks like a microphone at the bottom or the top of your screen. So we would welcome your questions. You can submit them via the chat feature, or you can hold them until the end of the presentation. So we'll do a full Q&A at the end of the presentation today. Today's program will provide an overview of how the lawmaking process works in Annapolis, discuss MedChi's 2021 legislative agenda, and provide you with key grassroots skills and tools as physician advocates. So we'll go ahead and begin our program. We're very fortunate to be joined today by Pamela Metz Kasemeyer, who is the managing partner of Schwartz, Metz Wise, MedChi's lobbying firm, and has graciously agreed to present at this session. Ms. Metz has more than 30 years of experience lobbying in Annapolis and extensive experience advocating on healthcare regulatory matters. Thank you for being here, Pam.
My pleasure, Krista. My pleasure to continue to work with the physician community. It's been an honor all these years, and I look forward to continuing going forward. Some of these slides will provide an opportunity to make some comments that you won't be surprised by, given all that we're dealing with at the moment. Not the least of which is the first opening slide where you see the gallery, well, even before that, where you see the gallery. It does not look like that now. They have plexiglass shields around all of the desks. And in fact, most of the legislators will not even be in person attending. They will not have full session for everyone, probably till the early part of February. At least that's the beginning. That's the thought. So session this year, and we can go to the next slide, but I just wanted to say that's how different that is. That chamber will never look like that it does this session. So, and this is, as Carissa had said, hopefully what we'll go through today, and I'm certainly available for any follow-up questions or anything we don't get covered today to follow up on, or if new questions or issues arise. My partners and I are always available to help you sort through or answer questions that may come even after this session. So, and I think this are some of the things that Carissa had said that we were going to talk about. How does the law work? What our issues are for this year, and ways in which you can get more involved in advocating on behalf of your colleagues and the patients that you serve. So this year, the session does convene on January 13th, as it is supposed to. Theoretically, it will adjourn on April 12th. The unknown factor, which doesn't probably really need to be said because I assume you have already have figured that out, is much like last session, there's a lot of unknowns about this session. While they have done a tremendous amount of planning to try to keep the General Assembly and the public safe, to be able to move forward and effectively address policy issues while recognizing the limitations that COVID has presented, there's also acknowledgement that things can go awry and we may see a shortened session. As a result of that, that is part of why I said they are starting bill hearings in earnest very quickly. There are almost 800 pre-filed bills, which is a great number higher than there usually are. There was a lot of encouragement for legislators to file their bills early, to file fewer bills than they usually would, and to only address issues that are immediately critical. Looking at the 800 bills that have been introduced, even those beyond the healthcare sector, Some of that has been observed and some of it hasn't, but the long and the short of it is they're going to be holding hearings in earnest early. They will all be virtual. And that has changed the way the session will flow. And I'll talk a little bit about that some more as we move forward with issues and process and ways in which you can engage. But as it says here, for those who haven't been involved before, the Maryland General Assembly has 1 senator and 3 delegates per district with 41 districts. And different maybe than what you hear in Congress or maybe from colleagues in other states, Maryland General Assembly basically is very subject matter specific. So their committee assignments, the committees have specific subject matter areas. Legislators are assigned to 1 standing committee. They may be on joint committees, subcommittees, interim committees, but they're 1 standing committee. So we have legislators that over time really are able to become very educated and knowledgeable about subject matter areas. It is why it is also therefore important that we actively continue to engage on an ongoing basis, because they know how to ask smart questions. They want to hear from us. They have, it's the area in which they work and they want to know what they are doing. So the 4 committees where most of our bills are heard. In the House, it's appropriations, which is where the budget work is done, health and government operations, which is most of the House policy with the exception of judiciary, which handles all of our malpractice and immunity and legal related issues. The Senate also has, 4 committees. We do have bills across all committees. Judicial proceedings has the litigation, immunity, malpractice issues. Finance has a lot of the health policy, although the House Health, Environment and Education Committee has a lot of the scope of practice and professional licensure related issues. And then obviously the Budget and Tax Committee deals with funding issues. But the committees is where the large majority of our work is done, because the entire body relies on the subject matter expertise of the committees to decide which bills come to the floor or not. We do on occasion have full floor debates on issues that we're involved with, but for the most part, we focus a large percentage of our efforts on working with the committees to try to affect the legislation before it moves forward to the full floor, either in the House or the Senate. These are the dates for bills this year, if all goes well and it adjourns as scheduled. Their introduction dates, as they have accelerated introduction dates from where they usually are. They are usually in February, but usually a little bit later. So crossover day is where it is historically, but all of that could move forward if in fact we have fallout from COVID as we did last session. But so these are theoretical calendar dates, but they are the current calendar dates for 2021. This is a little graphic about how a bill becomes law for those of you who have not been through this process. So in order for a bill to become law, it needs to pass both the House and the Senate in exactly the same format. This graphic is really a graphic related to a bill that is only filed in 1 chamber and how it passes through all the way to the governor's office. So let me run through that because it is the most simplistic, and then I'll add a little bit of complication to the process. The end result is the same, though. Any legislation enacted has to have passed both houses with the exact same language. So when a bill is introduced in the first chamber, it's called what's the first reading. It gets read over the desk by the clerk on the floor. I guess this year the floor will be empty, but the clerks will be reading the bills technically, and then it's referred to a committee, again, a subject matter committee based on the subject of the bill. The bill then is considered by the committee. There are hearings, there may be work groups, there are amendments considered. All of those deliberations are based in the committee. If the committee chooses to advance the legislation, either with or without amendments, those decisions get made in the committee. The vote from the committee and any amendments are then sent back to the full House floor for what is called the second reading. The second reading is where the committee reports out on what it wants to pass, including any amendments or otherwise. At the second reading level is where people from the floor, on the floor of the House or Senate, can offer additional amendments, where there is a lot of debate on what the committee has done or has not done. A bill can be defeated at the second reading level. It doesn't happen often, but it does happen. If the bill passes second reading, it goes to what's called third reading. It is actually reprinted in a way that includes all of the adopted amendments and any other changes to the bill, if there were any. The third reading bill then gets one final vote from the entire floor. It is a up or down vote. It is not like the second reading where you may have amendments and other kinds of things. Once it passes third reading in the first chamber, it goes to the other chamber. So let's say this was a House bill, it would then go to the Senate, and essentially the exact same process happens in the Senate. If this bill was not also concurrently filed, what's called a cross file, which I'll explain in a minute, and was only filed in one chamber, then what the Senate gets is a version that includes any amendments or other changes made by the first House, the House where it was introduced. That is what's considered in the second chamber, but the same process occurs. The committee itself does all of the work. It could further amend it, it could change it, it could adopt it, it could not adopt it. If the second House committee chooses to move the bill forward, the same process occurs at second reading. There could be additional amendments, there could be debates, the committee could offer. Once the second chamber goes from second, assuming it gets past that second reading and not defeated, it goes to third reading once again, reprinted with, there's additional amendments adopted that includes any further changes made by the second chamber. If no further changes are made by the second chamber, and then the bill goes back to the first House. If no additional changes have been made in the second chamber, the first chamber generally accepts it, and it will then go to the governor for signing. If for some reason the Senate has changed a House bill different than the House, and the two do not want to agree on one or the other version, it goes to what's considered a conference committee where the two houses attempt to resolve their differences. Assuming the differences are resolved, it then goes to the governor's office for signing. I know that's a lot of detail, but I think I wanted to, going through this process, if nothing else, reinforces the importance of the committees, because as you can tell from this graphic and from my discussion, the committees really are where the vast majority of the work is accomplished. How to read a bill. So a bill when it's introduced, and this is a bill that how it looks after the committee has reported it back to the floor. This is originally, you wouldn't see this favorable report. You would only see the beginning part to begin with, and it says when it's introduced and what committee it goes to. If the committee has passed it and it's moved to third reader, as I said, it's been adopted through second reader, then it has this additional section on it because the bill itself has been reprinted. So it helps you know where it is. When you look at the top, so this is Senate Bill 30. There's a cross file in the House for this bill called House Bill 1581. Not all bills are crossed out. A cross file is when identical bills are passed and are introduced in both chambers at the same time. If you look at this area here, Senate Bill 103/17, that means this bill was introduced in a prior year, and that was the bill number. It gives us and the advocates an ability to go back and look at the bill file, to go back and see what happened with the previous introduction of the bill and why it wasn't successful, so that we would know how to, which of those factors influence how we are going to react to the bill this year. So, you want to, a little bit more things. You will notice bold print is new. That's a new provision. Brackets mean it's deleted. If it's lowercase, it's not on this screen, but if it's lowercase, that means that's existing law. If you had bold, capitalized uppercase, it would be new language. And that's really how we take a bill and look and see what changes are being made when it's introduced. Again, as I had said, this is all newly proposed language, as I indicated in my previous sentence, because it's capitalized and bolded. This is, if you see an underline, that means it's something that's been amended into the bill after deliberation. So this would be a third reader. So the original bill as introduced did not have the nature of the crime. The committee, in amending the bill, added that language. So you will see they had to cross through the numbering and renumbered it because they added an additional provision. Okay. So that's a little bit about the process of how bills move and how you read them and how you know what it is that we're looking to address or evaluate. So for those of you who are interested in getting more involved, or we strongly encourage you to get more involved with this process, the more input we have from the physician community, the better, the more effective we are in advancing our objectives and our interests. At the MedChi level, it really, there's a couple of different levels of discussion on what our priorities will be. As you all may or may not know, there's something called the MedChi House of Delegates. In the fall is when it addresses resolutions and policy changes for legislative action. Those resolutions become priorities issue-wise for MedChi moving forward, and remain MedChi policy not only in the session that occurs after the fall House of Delegates, but going forward. So my colleagues and I, all of your colleagues, MedChi itself, when we have legislation introduced, if there is a standing MedChi resolution that has a policy statement on a given bill, that informs what our position should be. Should there not be already existing standing MedChi policy or resolutions, the Legislative Council itself, which is made up of physicians, reviews every bill that is introduced that could have some impact and that has been identified, and the Legislative Council makes a decision and recommendation on what the position of that bill should be and what our strategy should be. Communicating with legislators. This is really where you all are the most, your involvement is critically important to MedChi's and Montgomery County Medical Society and the physician community's ability to be effective in Annapolis. I wish I could say that my partners and I could take credit for all that we do. We love working with you. We love representing MedChi, and we hope that we are instructive and helpful in moving MedChi's work forward. But ultimately, the legislators do care what their constituents say. They do care what the public says. As I have said many times, and Carissa, thank you, I think, maybe for acknowledging that I've been around for 30 some years. I am getting old. I am not cynical. Despite all of the mess that we see in politics at times, I can tell you I've seen bills move due to conversations with one or two people the legislators really do want to know from people. But one thing I must also say, they have a ton on their plate. It is much like all of you with your very, very busy schedules. And this shows you how old I am because I use this example all the time. Do you remember, for those of you who are old and everything wasn't electronic, you used to get your little pink, messages about messages you've gotten for the day that you had to respond to? Everybody, it's human nature, shuffles those and decides, I can only return 5. Which of the 5 of the 30 do I return first? And I think most of us prioritize the people we know, or some name we've heard, or someone we know is going to have something important. So this is why I say to you often, and you've heard from my colleagues, and we continue to say, it's critically important that we know our legislators before we need them. Not because they don't care, but because it's very challenging for them, just as it is for you or anyone else with very demanding jobs, to stay on top of everything at all times, no matter how committed they are to trying to do the right thing. So the end of my little get to know them before you need them. But I think that it's partly why we spend a lot of time talking about how to communicate, why Susan and Carissa and all of your people as well as MedChi works very hard on trying to help you all connect with your legislators over time and develop those relationships. So the prior screen, the picture, sort of like the thing, showed you don't start like this. Sorry, this is a little bit too analogous to Washington, D.C. at the moment, which is very scary. But anyway, so go ahead, Carissa. So ways you can get involved, serving on the MedChi Legislative Council. That is a little bit out of my purview to explain how that works. I know there's appointment processes, but it is physicians who are the members of the Legislative Council. Component lobby days. Unfortunately, I will tell you these won't be occurring this year because there's nothing in person. The legislative office buildings are closed. There's a provision where you can have a one-on-one meeting, but you actually get escorted up to the office and escorted back out immediately. So there's really no public interface for this session other than by Zoom. You can do Zoom, you can do audio, you can do calls, but our normal in-person meetings are not going to be occurring like they have before. Contributing to the PAC, obviously, campaign contributions. Politics is not all about money, but people do need to get elected. Get to know your delegates and senators. I already gave you that little spiel, so I won't have to repeat myself. I know Susan and her staff, your medical society, as well as MedChi, we issue communication to you when we need to do specific alerts or reach outs when things are exceedingly important or maybe going south or we need some extra reach out. Please, if you're contacted to engage with those alerts, please do so. They do notice how many calls and emails and other things they get on specific issues. And then here we go about communication. This is probably pretty intuitive for all of you, so I don't mean to be overly simplistic, but I think my partners and I have felt like if we don't say it and it doesn't work, then we're going to be sorry we didn't at least tell you, even if you went. I know that. So once again, try to establish ongoing relationships so they know you before you need them, and that gets involved with getting involved early in the process. Know what subcommittees and committees they are on so that you can be very knowledgeable about what roles they can play for which issues. And it isn't that all legislators aren't important, but some have more influential positions and or position to help us more than others. And we try to focus on them first because we can only get to so many people so fast. Go ahead. And when you speak to them, know exactly the subject matters you're talking to. The bill numbers themselves, sometimes they'll know them, sometimes they won't. They're more likely to know the subject matter. They may know the title, but they're going to know the issue. That's really what they want to hear. The bill titles themselves and things like that become administratively managed through the committee. The subject matters are what they want to hear, and they want to hear your personal opinion and your personal experience. So anything you can give them that gives them a real boots on the ground picture of what you're talking about, how it affects you or your patients or your community, that's what's going to stick with them more than, say, research or something like that. This is personal. They want to know from you. And do not try to do too many subjects at one time. Maybe you aren't this way, but I know if someone floods me with too many things at one time, I have a hard time remembering all of what they said. We usually will try very hard to focus you on 2 or 3 priorities that are most important, or it may be a legislative alert on one specific piece of legislation where we're either making great progress and need to, or having challenges and want everybody to focus on it. So we hopefully will help you with that restriction to just a couple of topics. And then once again, use your own words. We work very hard at not doing like blast emails where the staff person gets a paragraph that is exactly the same from every single person, because then they really know that the person sending it may or may not be as committed as someone who has crafted their own message with their own words, whether it's an email, a phone call, a meeting, or whatever. Using your own words really does make a difference. And again, this is sort of obvious, but we need to say it anyway. MedChi is a very influential organization. The physician community is a very influential interest group, but the legislators don't need to hear that. They know that. And there are many of them which are somewhat happy to show you that you're not as important as you think. If you make them, if you come off as saying, you better listen to me or else. So they will respect your manner and your means of approach and your education as much or more than just that you're from the medical community. So be very cautious about that. And also, we do the best we can to educate you about some of their leanings, allegations, philosophical touch points, because sometimes you'll be talking to a legislator that has a particular perspective and we want to change it. We'll do our best to help you know what that is before you communicate with them. But it also therefore means it's usually a good idea not to impugn others, but rather to strengthen your arguments, and the other negatives from the other side become self-evident in that way. So this is it's not the end, because I do want to run through the 2021 priorities, which I can do very quickly. Many of you may have seen the agenda already. We didn't have slides for it because we're just getting it pulled through. So usually, and these are pretty quick. I know that there's a 2-page document that I think Carissa may have put in the chat box, or if not, we'll be forwarding to you. I'll let her cover that, but let me just run through it really quickly. So for 2021, Maryland will continue, or MedChi will continue to work strenuously to protect scope of practice issues. As you well know, there have been a wide range of issues related to scope of practice. Oh, this is good. This is even better than what I had. So you can run, there's scope of practice issues that we'll be working to protect. Also the medical liability framework, to make sure that we don't see the trial bar undermine what is already sometimes sort of a dicey malpractice situation or tort scenario in Maryland. We will be looking at ways to make sure that we can ensure timely delivery. Telehealth is going to be a huge priority for our legislative advocacy this year. And I know we've already done some talking points on telehealth, which I'm sure that Susan and Carissa and others will share with you. Audio only reimbursement, other issues relative to telehealth is going to be a huge issue. concurrent with that, we'll continue to make sure that we continue to work on addressing administrative challenges with querying the PDMP, Immunet data entry, and others. It's going to be particularly interesting to see how that moves forward, especially since Immunet is now going to be required for COVID vaccine administration is going to have to be entered into Immunet if you are administering it. So that'll be an interesting challenge for the Immunet system, generally speaking. We continue to work with the Board of Physicians, but also monitor their activities to make sure that the disciplinary process is transparent and accountable. There are obviously going to be a number of public health initiatives under the health equity framework. There's going to be legislation requiring implicit bias training of all licensed healthcare professionals. There's going to be an effort to create a health equity commission. That really isn't for just healthcare sector. The commission is proposed to have every single agency in the state agency, transportation, commerce, across the board environment, because they want to infuse a health equity framework for evaluating state policies even out of the healthcare sector. So we will be involved with all of those issues as they move forward. Obviously, police reform and its tie to mental health issues will be a center of we'll pay attention to those as well, including immunization, including also workforce issues, and then anything tied to the continued issues associated with managing this public health pandemic and COVID. So you'll be able to get that document and read it more carefully. I want to close at this point so that we have time for questions and answers if anyone has issues or thoughts about the information that's been presented.
Okay, well, I just wanted to first acknowledge the comment that Dr. Farkas submitted via chat. Dr. Farkas, would you prefer to unmute yourself, or should I read your comment?
Sure. So basically, everybody probably knows that there was this massive demonstration at the Capitol, and it's going to become a super spreader event. And so all I'm saying is that in a few weeks, there's going to be loads and loads of cases, a few more weeks, loads and loads of deaths. And so I think that Pam was really right when she said that it's likely that the legislative session is going to be foreshortened. So that's the thing I want. Now, just the other thing, just on a personal level, I'm retired, so I probably can't really comment effectively on a lot of the medical practice issues, but I do have some public health training, and I'd be overjoyed if you guys want to have me talk to somebody about a public health issue, of which there are certainly important ones. And I have met Senator Hettleman a few times, so I know her. She knows who I am, so that might help.
Good. Good.
All right, did we have any other questions from folks who have joined us? You can hit *6 if you're on the phone to ask a question, or you can submit it via the chat feature.
Hey, can you hear me okay?
We can.
So since I've been an employed physician forever, so Pam, what issues are particularly useful for employed physicians to talk about? And I've always thought that a lot of the issues that we bring to the table are particular to private practice. But are there issues, especially since more and more of us are employed physicians, what are good things to talk about, both during session, but especially in between sessions?
So for this year coming up, I do think that all of the telehealth debate is going to be exceedingly important, which I think has been a tool that both private practice but employed physicians have found to be exceedingly useful for patient access. The carriers are pushing back, and largely the fight will be over audio only. and about parity and reimbursement for in-person versus telehealth. The audio only piece, there's already a lot of pushback from them about we're moving too quickly in that direction, and the carriers will sometimes use this, examples of, well, the doctor called to say, you need to come see me, and then they go see him, and then you bill for 2 visits, and why should that happen? And it's not really happening that way, but we've got to be strong in our arguments about what we have learned about how important the telephone only option within telehealth is for elderly, those with technology limitations. There's lots of parts of the state, and this may not be as true in Montgomery County, but it is true anyway. People don't have connectivity, they don't have technology savvy. And it isn't to say, and our argument isn't going to be, and we have to be very clear about this, telehealth when appropriate clinically, not everything can be done via telehealth. And also, yes, everyone agrees it's better in person if possible. But we've learned that there's many times where it's not possible, but there's also in these bills things about remote patient monitoring and things like that. And I think there's a number of you and your colleagues who have found that the potential for enhanced outcomes from remote monitoring and follow-up and things like that is very good. Attendance is better. So I think we're going to have a lot of work on telehealth. So, and I think that crosses the employed and private practice physicians quite a lot.
The major objection from the payers is that a video visit is less likely, it's more likely to be effective, so less likely to generate a second billing, whereas the audio is less effective and therefore more likely. Is that the main argument?
I think that, yes, I think that's correct. I think that's correct. Yes.
I had a question. Is the plaintiffs bar really gunning for us this year? I mean, they have a hell of a nerve. I hope we're in a strong position to show the heroes, not me personally, but our frontline people at the hospital and whatnot.
Right. So that actually, thank you for bringing that up, Dr. O'Connor and Dr. Feurenstein, back to the employed versus private practice. We are going to have legislation this year that we're working on too relative to immunity. I don't know that I see the trial bar being as aggressive at undermining the existing framework, but I think the problem that has arisen with COVID, and where we need clarification in the other regard, is that you're going to need some immunity for some uncontrollable circumstances that have arisen that have nothing to do with practice and everything to do with the environment and COVID and how that's related. So there is going to be legislation advanced that we're going to be supporting that provides immunity and answers some questions about the unknown pieces of the COVID pandemic and your ability to respond to the public and patients. So that is, again, I think crosses all categories of physician practice unrelated to private practice or employed.
I don't want to take a partisan approach to this, but along that line, so the stuff that got hung up in the federal, I know we're state, but that federal thing they were trying to do with protections for businesses, is that the same thing you were just talking about? So, would that extend to the state, that stuff that was hung up in Congress about federal protections for businesses? Is that the same thing you're talking about?
It's similar but different. That was more related a little bit to the spread of the disease and a little bit to workers' comp and other kinds of issues. It wasn't as much to there isn't sort of an analogous malpractice situation in a business circumstance as much as there might be litigation for, well, I worked there and I caught the disease.
Right, office staff or patients in the waiting room,
And
right,
so
that kind of stuff.
if those kinds of protections are afforded, they will not be probably occupation specific. But what I'm talking about is really related to health outcomes and healthcare practice and other things related to the provision of services that are in a very different framework than normal because of COVID, and making sure that it doesn't create new bases for malpractice litigation. So it's a little bit different. I think both will be considered, and we certainly want the protection in both circumstances, but our focus really is in making sure that there isn't an undermining of our what stability we do have in the malpractice environment by creating potential litigation around things that we have no control over.
All right, so I know that Pam has a hard stop here. So I'm sorry to cut us off maybe a little shorter than we otherwise would have. I just want to say thank you all for joining us so much, and thank you so much, Pam, for being here. We will make this webinar available online via our YouTube channel afterwards. If you'd like to share it with any of your other physician colleagues, we encourage you to do that. If you do have follow-up questions coming out of this, we are happy to put you in touch via email and get back with you. A few things before we hop off tonight. I did want to remind you that MedChi continues to coordinate all clinician calls with Dr. Howard Haft of the Maryland Department of Health on COVID-19 every Monday and Wednesday. A lot of really valuable information, particularly about vaccines on those calls lately, so I encourage you to participate if you can. MCMS does have a webinar coming up that'll discuss the latest stimulus package, so please keep an eye out for that in the next week or so. And then we also have extensive COVID-19 resources, particularly with regard to vaccines and how to get them for yourself and your staff. So if you do need any assistance with that, please don't hesitate to reach out to us. You can even do it by responding to our post-event email. We're here and happy to help you in any way we can. So thank you all again so much. Thank you, Pam, for being here. We really appreciate it.
My pleasure, and thank you all. And myself and my two partners, Dana Kaufman and Steve Wise, continue to be thankful for the opportunity to work with all of you, and are available should you have follow-up questions or need further clarification on anything we talked about tonight. Please don't hesitate to reach out.
Thank you, everyone.
Thank you, Pam.
Thank you.